Hi there, I'm Dr. Hirsch. Nice to meet you. Please sit.
Nice to meet you.
I see you got the decision aid that Carrie gave you.
Yes, it was very helpful.
That's great. I understand you're having angina or chest pain, and that's been steadily getting worse over the past several months.
Yes, I can barely do anything now, even if I use nitro before I start. It used to work pretty good in the beginning, but I can't live like this.
Well, that makes perfect sense. The dye test today showed two very tight blockages in two different arteries of the three in your heart, the LAD, which is a front wall artery, and the circumflex, which is a side wall artery. The circumflex blockage is long and has lots of calcium in it. That makes it a little more challenging for some of our treatments. I see that you're diabetic, but your hemoglobin A1C is under some pretty good control. I see your last level was really in the normal range.
Yes, I work with my family doctor on that. I try to eat right, I exercise. I'd like to get back to exercising, so what can be done for the blockages?
That's great to hear. With that kind of attitude, I'm sure we can get you a good result with a couple of different approaches. The first approach we could use is just to adjust your medications. Your doctor's done a good job. You're on a pretty good regimen of drugs, so I think the likelihood that changing medications will make a meaningful difference to you is pretty low. Stenting is a possibility. I'm sure you have friends who've had a stent. It's also called angioplasty. The challenge for you is that circumflex, that sidewall blood vessel, has a lot of calcium and will require a procedure called rotablation, which is to go through and cut away the calcium, and it's long, so there'll be multiple stents. So that makes the durability of that procedure come a little bit into question, but I think it is feasible to do. The front wall artery would be straightforward for a stent. Another option is bypass surgery. It's more invasive. We have to open your chest, open your breastbone. You're a well-controlled diabetic, so I think we could use two arteries as our bypass material, and this would be very durable for you, but the front-end cost would be higher, and the recovery rate would be, the recovery time would be about 6 weeks as opposed to more or less overnight with stenting.
Is my risk of death different between the two?
Yeah, that's a great question. As you can see with these dot plots, at 5 years, with either stenting or with surgery, your likelihood of being alive is the same. You can see here there is a higher risk of stroke with the surgical procedure, but it is low overall, still just about 1 in 100. There is a higher risk of transfusion, much higher with surgery, but it's only about 20%, and the blood supply is really quite safe now, so that really shouldn't cause any permanent injury. With the stenting, there is a higher likelihood of a second procedure over that 5-year period, whereas with the outset strategy of surgery, it would be very unlikely that you'd need anything done in that time period.
Okay, thank you. I'm leaning toward a stent because I run my own business, and if I don't work, I don't have any income for myself or my family. Do you need an answer today, or do I have time to consider this?
So it's great that you're thinking about how each procedure fits into your own lifestyle and requirements. There's no rush for an answer. This is my card, and it's got both my office contacts and that of our patient navigator, and between us we can get your questions answered if more questions are developed, and just let us know when you've arrived at a decision, and we can make appropriate arrangements to have either treatment performed.
Okay, thank you. I think I know what I'm leaning towards, but I'd like to discuss it with my family.
Okay, thank you very much. Lovely to meet you.
Thank you, doctor.